Good morning, everyone. I'll ask you to take your seats if you're standing at the doorway. My name is Tanya Massa. I'm the Director of Programs at the Ontario Centres of Excellence. I'm delighted to welcome you to the Experiential Learning Competition. The Experiential Learning Program is designed to help students across Ontario get the training experience they need to turn their ideas into market-ready products and services by learning and doing. I'd like to introduce you to our moderator, Andy Wilkes. Andy is a partner with Management Initiatives, a business advisory and investment firm in Ontario, Toronto. Andy is an active angel investor and as a champion within the angel community. He is a past chairman and a founding member of the National Angel Capital Organization. Please join me in welcoming our moderator, Andy Wilkes.
Thank you. Thank you, Tanya. I'll just start by saying I'm also a deal junkie. So one of the things I do is I get sucked into, I'm not sure I should use that word, but into innovation and some of the business I'll hear about. And then I go home and I look at the mirror and say, gee, Andy, how could you help these businesses? And then we kind of move on to the next one. But I really get excited about innovation and businesses and look forward to the presentation today. So my name is Andy Wilkes, and I'm delighted to be moderating this exciting competition. As many of you know, encouraging, mentoring, and nurturing the next generations of science and technology talent here in Ontario is critical to driving the economic sustainability and prosperity of this province. The Experiential Learning Program does this by supporting Ontario post-secondary institutions by helping them manage and grow project and experience-based programs for young entrepreneurs. The aim is to accelerate and further improve the quality of new ventures and industry collaborations coming out of Ontario's colleges and universities. And I might add that I think you're very fortunate to have a program like this. I wish I'd had it in my youth, and I wish I was 30 years old again. But today we'll be awarding 3 prizes of $25,000 to our competitors, which ties in, I guess, to these incentive prizes we were talking about yesterday. And so now I'd like to introduce you briefly to our judges, and you can get further information on the Discovery website. Our first judge is Julia Deans, and Julia is the CEO of the Canadian Youth Business Foundation. Julia joined the Canadian Youth Business Foundation as Chief Executive Officer in January 2013 with a track record of success in the corporate, entrepreneurial, nonprofit, and public service sectors. She started her career as a lawyer, practicing law with Tories in Toronto and Hong Kong. That's a good thing. My daughter's a lawyer. So before taking the leap into entrepreneurship, where she successfully created and ran a business in Singapore, and we're delighted to have Julia here today. Our second judge, I don't know if you've sort of waved or okay, good. And our second judge is Janet Schultz, President of the Alliance for the Commercialization of Canadian Technologies. Janet has extensive background and experience in the fields of intellectual asset management, business development, technology transfer, university, business, and government relations. Thank you for making the time to be with us today from the West, Janet. She's recently moved to the West and is some 8 hours from Calgary, so thank you for coming. Next on the judging panel is Narinder Dahal. Did I say that properly? Narinder is currently the Vice President of Finance, Programs, and Administration for OCE. He also holds a board position at Renewed Computer Technology, a not-for-profit charitable organization that refurbishes and redeploys computers in schools, charities, and other. It says here, NFPs. Now, the acronyms that I've seen around this place are amazing, but anyway, everybody knows NFP stands for not-for-profit. Thanks for joining us today, Narinder. Our fourth judge is Daryl Johnson. He's the Director of Market Development, Technology and Media, Telecommunications, and Clean Tech at Deloitte & Touche. Daryl is well connected in the, and here's another acronym, in the TMT space with over 20 years experience working with high growth public and private TMT clients across a broad range of industry subsectors, including telecom, high-tech manufacturing, and clean tech. And I know Daryl very well, but welcome. Our third judge is in traffic, I understand, so we'll introduce him when he arrives. We'll get into the student presentations in a moment, but I wanted to share one thing with you. I run marathons, okay? And one thing I learned after running my 5th or 6th was to smile when I was running marathons, because it loosened me up and I actually performed better. So I hope today we see some smiles and we have some fun. I know there's a big prize, but at the end of the day, this should be about learning and having some fun. So on that note, I'm going to go over to the other spot and sit with the judges, and I'd like to bring forward the first. Actually, does everybody know the ground rules? I should just briefly say you have 5 minutes, and then there's a clock that's going to be following you, and then we're going to, and there's going to be people saying time's up, and then we're going to have a 5-minute Q&A. Okay, everybody knows the ground rules. So if Abraham Heifetz from Camatria, Inc. Would come up, and if you'd introduce your team members, I'd appreciate that. And of course, in this case, you've had support from the Institute for Optical Sciences at the University of Toronto. So over to you. I'll shake your hand, Abraham. Thank you.
Hello. Very good morning to you all. My name is Abraham Heifetz from Camatria, and we write software for pharmaceutical companies to make the development of new medicines more efficient. And here on one slide is the problem in pharmaceutical development today. The amount that we spend to find new medicines has more than tripled over the last 15 years to $50 billion, while the number of new medicines that we get for that has really plummeted. And this gap is unsustainable, and it's getting worse. So why do we have this problem? Well, this is a chart that shows the various stages that every drug has to go through, and it's from a post-mortem that GlaxoSmithKline did on an antibiotic project. And if you multiply the success rates for each of these stages of drug development, you find that a new project has less than 1/5 of 1% chance of succeeding. So how do we get into this mess? Well, I'll put it to you that part of the problem is we're using technology that hasn't substantively changed in hundreds of years. In contrast to all other forms of manufacturing, so every car that you drive in, every plane that you fly in, those are designed in computers before they're ever built, but not medicine. In medicine, we still build every single prototype, and we test every single prototype to see what it's going to do. And what you'd like to replace those test tubes with software. You'd like to get those same efficiencies that other kinds of manufacturing have done and get them for drug discovery. And so that's what we do. We're writing that software so you can design the computer. Now, this is a good idea. It's not my idea. People have been trying to do this for about 30 years. So part of what I need to do today is convince you that there's a reason to believe we can do better today than what we've done in the past. And of course, today, we have far bigger computers than have ever been available before. So at Camatria, we're using Canada's #1 largest supercomputer to do the kind of modeling that I'm talking about. And if you were to buy this amount of computation on Amazon's Elastic Compute Cloud, that would cost about $8 million. But because we have access to this through OCE and the SOCE program, we're getting that for free. And I should mention, because it's through that program, it's not that IBM is taking a piece of the IP. Having this kind of supercomputing power lets us use far, far more data than has ever been applied to this problem before. And there's this adage that there is no data like more data. This lets us build better statistical models and make better predictions. I should note, by the way, I'm going to talk about performance in a second, but today we're using 1 million data points, which is still orders of magnitude larger than our competitors that use thousands. But there's even more available than we're using today, so there's reason to believe we can do better than we are today. And what that's going to do is it's going to give us the same advantages in speed and money over traditional test tubes as existing software, but it's going to move us to being usefully accurate, where these predictions really matter. So let me quantify what I mean by usefully accurate. On an industry standard benchmark of 102 diverse biological disease targets, we get 60% of our predictions correct. And that's versus 20% by a state-of-the-art competitor, probably the most cited software out there gets 20% correct, we get 60. And as I said, we think we can do better. What we're going to use that software for is to focus on what's called drug repurposing. And the idea here is that all molecules have side effects. So what you should think about is people take aspirin for headaches, but they also take it to prevent heart disease. And so when you can find these drug repurposings, you don't have to figure out how to make the molecule, and you don't have to figure out whether it's safe. And that eliminates these stages in drug discovery, which makes the whole process more efficient. So what we expect to do, so there's the technology. Let me tell you a little bit about the business. What we expect to do is take molecules in the patents of large pharma companies, possibly that are coming off, predict them for new targets, for example, in the 102 in the benchmark that we have, and any that light up, we can license that new use to the pharma companies. And it's not that we want to do drug discovery ourselves, but it turns out that most companies get acquired for substantial money, $156 million on average, without having a drug on the market. So it's not that we need to do full drug discovery ourselves. We want to avoid that. So I have experience at high performance computing, IBM TJ Watson Research Lab, and my co-founder has written drug discovery algorithms before, and we want to hire people with prize money. Thank you. Questions? Yes.
Who would like to start?
Sure.
Daryl has a question.
Okay. Abraham, first off, good presentation, well presented. I would like to, I looked at your group of mentors, very impressive group of mentors, past entrepreneurs, experts in the field. Just my own curiosity, has any of them come forward and wanted to put investment into you as well?
So we've sought investment from government sources rather than dilutive. So right now we're working on grants, OCE Market Readiness, for example. We also have a grant from Grand Challenges Canada to do malaria development for the developing world, new treatments for malaria. So right now we're running on non-dilutive funding, and we want to prove out some of the technology, and then we think that will really take us to an inflection point where when we raise money from people, you know, there's less risk for them and more value for us. So we're holding off on that right now.
Great.
Thank you for the presentation. A couple questions about the supercomputing aspects of your technology and your algorithm and your business. Actually, you're using an $8 million as a supercomputer for free right now. At what point do you have to actually buy your own supercomputer, or are you expecting the pharma companies, the small pharmas that you might be selling to actually have their own cluster or supercomputer or access to such a thing?
So in fact, the prototype that we built began running on commodity clusters. So it's not that you have to have a supercomputer, it's that the supercomputer lets you do things that commodity is expensive to do on. But in the absence of the SOSIP Blue Gene, we would be running this on Amazon. And we wouldn't be spending $8 million, we'd be spending less than that. But the performance that I showed you is actually achieved on commodity clusters. The supercomputer is going to let us go beyond that to more refined models, more accuracy, and so forth.
Thank you.
So I have a question related to your monetization plan.
Yes.
And have you run that plan past any of the pharma companies? I'm interested because you mentioned that your income would be derived from royalties for licensing the NMEs to those companies. I'm thinking, they already own the rights to those drugs, so your monetization plan seems a little, in the explanation that you provided, it seems a little shaky.
Sure. So right now, there are patents you can file which are called use patents. So there's patents which you can file which are called new composition of matter, And so what they have is new composition of matter. But when you say no one has ever alleged that there is a use, let's say, Tylenol cures breast cancer, right? No one has said that it does this. Then you can get what's called a new use patent. And that would be the license that you would give to the pharma company. So unknown uses for existing molecules. And here, the point is that today, from the farmer's point of view, it's money that they're leaving on the table, right? It's uses, it's value in the molecules that they've already sunk cost into, which they can't derive today. And so what we would be providing is we're unlocking that. We're saying, well, look, you could use it for this and this and this, right? Like there is value there. And you would need to file these use patents, and those are the ones that you would license back to the companies. So companies already do this, like a number of small biotech, small pharma companies. This is the model that they do. We have a computational technology which drives that process much faster and repeatably and scalably. So that's the difference, really.
I assume that companies are using some of the existing systems that you talked about and that are 20% accurate, and you've got 60% accurate.
Yeah.
What is the pitch to the companies when you're saying I've got this 60% accurate? They're still going to have to invest in follow-on testing, et cetera. So what is the pitch to companies to replace their existing assets with yours?
Sure. So, at the end of the day, the proof is in the pudding, right? It's whether, when we talk to people who use the existing software today and we say, are you happy with it? They say, well, look, it's better than nothing. And so it's not that they have really deep connection to the software and they want to maintain it. In fact, it's pretty common practice to buy several softwares, run them in parallel, and then try to divine from the tea leaves a pattern that you can then execute on. Because what's the alternative? The alternative is to do things randomly. And so what we'd be providing is an adjunct and...
Abraham will have to wrap up now.
Okay, well, I'll just finish the sentence. So an adjunct and a replacement where the accuracy speaks for itself.
So thank you very much. And,
Thank you.
If Chris could come up to the podium. Do you need more time? Okay. They're just going through a little bit of a scoring process here, not to put the pressure on. So should we start on the next one? Okay. So this is Chris Anderson. Welcome.
Thank you.
He's from Easify, if I pronounce that properly.
That's correct.
And the accelerator program is the Center for Enterprise and Law at the University of Windsor, the sponsor. So if you can introduce your team members and the presentation's over to you.
Definitely. All right. Well, my name is Chris Anderson. I'm the co-founder and CEO of Easify. This is my co-founder, James Henderson. I've been very fortunate to have worked with him. He is my CTO. He spent the last 10 years traveling the globe, places like South Africa, India, and across North America, coding all sorts of great projects. So he takes care of all the technical stuff that I'm not that good at all the time. My background lays in digital marketing, as well as user experience design. And I've founded 5 businesses to date, Easify obviously being the largest and the most exciting. So, James and I, when we first sat down, we were starting to work on Easify, we realized 2 things pretty early on. We had to build something that was really beautiful, and we had to build something that stood out from the rest of the herd. So with these 2 things in mind, we sat down, we figured out a problem that we could solve, and we formed our core belief. We believe that people should connect with what they love as easily as possible. The problem that we solve? Well, picture this. You guys are shopping in a retail store. You think you finally found something that you like, but you want a second opinion. So you ask whoever's shopping with you, or you talk to the store clerk, who isn't always that helpful. Furthermore, what if you're shopping online? Then all you have are anonymous reviews that aren't always that inspiring and aren't too relevant. In steps Easify. We are the perfect balance between a social network and an e-commerce platform to make discovering, sharing, and purchasing your products that much easier. We put you in touch with the people that you care about most, bringing the social experience of retail to the World Wide Web. We do this in a variety of ways. The first, personalized discovery. Receive interest-based recommendations just for you. Discover with the people who care about the same things that you do, search for them directly, or tap into the community as a whole. Meaningful conversations. Share with people who matter. Bond with friends, family, and key influencers over discoveries and inspirations. Then, form meaningful conversations and true feedback that you actually care about, using your thoughts, photos, videos, and emotions. Third, no limits. Share anywhere, anytime, from any website or mobile device. Second stage, integrated stores and a marketplace, business pages, and a full-fledged advertising platform, bringing the experience full circle. So, who is the customer? Plain and simple, the 21st century consumer, each and every one of you. Initially, we'll target the clothing and accessory segments simply because of its sheer size and volume, and then move into sporting goods, shoes, and music before opening up to all types of small business and large brands. Easify makes its revenue in the form of 3.5% seller fees off of everything that's sold on the platform. Additional revenues will come from the advertising platform and future products such as retail integration and partnerships. Our current IP position, we filed for trademarks in both Canada and the US. We have trade secrets in the form of source code and algorithms, with future plans to patent these trade secrets after we've come to market in order to stay competitive. OCE funding. We'll use $10,000 to go towards new hires here in Ontario and $15,000 to further protect ourselves and grow in the legal sense. Our expected outcomes, 2 part-time hires by the end of this month, 7 full-time hires in Ontario by the end of 2013, a small angel round of fundraising within 60 days, as well as a seed round later this summer. Our public launch of the social network will take place in late 2013, and the e-commerce component will launch in mid-2014. We're currently in private beta right now. Last but not least, we expect to completely redefine how people and products are brought together, period. Thank you.
Well done. So Chris, we'll now turn it over to questions from the judges. Sure. And welcome, Hattie. I'll introduce you after this session. Do you have any, where are we going to start?
Start a decision?
Sure.
Okay. I wonder if you've looked at how people make their decisions when they're doing online shopping, and I'm sure, like everybody here, you immediately go to what your own experience is, which is I want to buy it in the next 50 seconds. How would this sort of product inform a decision that's generally made fairly quickly, or am I in the minority?
No, you're not in the minority, that's for sure. What normally happens is typically people do want their decisions made fairly quickly. So if they do want feedback, they want it in 30, 40, 50 seconds or within the next few minutes. The nice thing about Easify is that it allows you not only to share to users on the platform, but to any mobile number that you have, any email address, any Facebook or Twitter account. It links up with everything. So you can get that feedback instantaneously. If you're not getting in contact with the people that you want to get in contact with, to make that decision, there's also brand communities on Easify to help you with your decision in that way.
So we're assuming that my 150 people are going to be able to come back to me within a minute on a product I'm interested in.
Some of them will, some of them won't, but that's exactly why we give you so many options to reach out to people.
Thank you.
Jana?
I just have one quick question. It wasn't clear to me from the written materials, this stage of development, because there are a number of components that if I read correctly, you're planning on adding. What's the stage of development in terms of the ultimate product? Which
Like I've said in the presentation, we're currently in our private beta. So in 6 months' time, we want the entire social component fully built out for the public. So that'll go live in about November. About 9 to 12 months after that, the e-commerce component will come out, but we have to have enough users for it to be even worth putting that in place from there. The life cycle of the company, we're planning about 5 to 7 years, just because we do want to raise the seed round to grow more quickly. So likely within 2 to 3 years, the entire product will be out on the market, and 2 years after that, we'll have our break even and actually be profitable.
You compare yourself to the website Fab, I believe, in the materials. Yep. And Fab, I went to their site, and they use a very niche marketing strategy. They go places, they sell things that are not sold on Amazon and all the other major retailers, e-retailers. Whereas it looks like you're planning on going head to head with those guys, or try to carve off a little piece of their business. Could you just fill us in on why the strategy to go up against the big guys in a couple of years?
Sure. Amazon and eBay, they've been around for about 10 years, right? So they were built for e-commerce first. Now they're trying to add in social because social is becoming more popular. They weren't built like that from the ground up, so it's always sort of like a jumbled experience. It's not truly social. And the tactics that we are using, we're going after clothing first, which is open to everyone. We aren't going after books, which is Amazon's bread and butter, and eBay's speckled of everything. It doesn't really have one major thing that it sells. So by going into clothing and then spreading into the other 3 niche markets before opening up to everyone else, we're hoping we can get a big enough chunk of the market that we're not going to get diffused too much by eBay and Amazon and other big competitors in the market, that we can actually grow complementary with them as opposed head-to-head.
Thank you.
Just one question in regards to your competition. You're right, it is a crowded space in the sense that it looks like there's a lot of noise there, you need to stand out. Would you be concerned if somebody like a Facebook said, hey, this is a great idea, we should do it, we've already got the network? How would you respond to them?
Facebook has tried to get into what I would call e-commerce, even though they haven't really done it properly. They've introduced storefronts. It kind of fell flat on its face, or I should say it did fall flat on its face. They were built as a social network first. They were never meant to sell anything on the platform. So even though it's easier to connect with all the people on the platform, the experience really just isn't there. They don't understand e-commerce to that point, or at least they haven't been able to develop it to that point where it's actually effective on Facebook. That's the difference by us launching as a social network with e-commerce planned for the future. We can put the right pieces into place so that we are actually able to compete with them head to head. As time goes on, Facebook wants to grow socially. They make money after advertising, so selling things on the platform would just be a very small percentage of their overall revenues. It's not their primary source of focus.
As my colleague pointed out, and also you mentioned in your presentation, this is a crowded area. How do you differentiate from others, and how do you protect this differentiated idea?
Definitely. Easify, what differentiates us from everyone else is the high level of personalization and the close-knit community. So Facebook, the average person has between 400 to 600 friends, some less, some more. You don't necessarily know everyone on there. Twitter, you don't know everyone else either. On Easify, it's 150 of your closest friends, family members, and key influencers. So it's really the people that you actually care about.
Thank you, Chris. So if you could deliberate, and we'll invite Matthew up to the stage. One of the learnings that I've had over the years is finding a commercialization customer. I haven't asked questions, but to the extent you work with customers early on as you're looking at your business models, I would encourage that. That's just a comment from the floor here. Is everybody okay? Okay for the next one? You good? Everybody good?
Am I waiting or am I going?
So Matthew, you have some video. Are you okay with your technical?
The amazing tech in the back has managed to convert the video files into WMVs, so everything is good with the video presentation.
Okay,
so.
Thank you, Matthew.
Yep.
So this is Matthew Gardner. He's with a project called Groupnotes, and working with Xerox Center for Engineering, Entrepreneurship, and Innovation with McMaster University. So over to you, Matthew, and please introduce your team members.
Okay. Hi, I'm Matt, and this is Jason. We're from Groupnotes. And we're here today to tell you about what our team's doing and to obviously ask you for some funding. So the problem that we're addressing is sharing. People do a lot of it right now online, but what we find is no one's doing as much as they really want to. Now, I'm not talking about the sporadic public social sharing you do over, say, Facebook or Twitter or even Pinterest. I'm talking about the enormous amount of online content you would never, ever share over public social channels. So maybe a decision about a tool purchase, competitive intelligence, or even some teenagers sharing like a nerdier than normal YouTube video. There are dozens of conversations you just never want to have over open social media. Now, this sharing has actually already been perfected. It looks like this. You point to your computer screen and you say, hey, check it out. But the problem is, when it's not that easy and it's not that private, there isn't a good way for you to share the dozens of things you want to every day online. So, right now you might be thinking, hey, I share all that stuff over email. But the thing is, when it's not that easy and not that simple, there isn't a good way to do it, and I'm going to show you why. So, here's where the video comes in. Oh no, after this. So, if I want to share this article with Jason, my co-founder, because this paragraph is super relevant to the two of us, what do I have to do to share a single paragraph with him online right now? I need to open up a new tab. I need to navigate to Gmail. I need to hit compose. I need to add his email address, and this is assuming I'm logged into Gmail and I have him added in my contact list. I need to add a subject line so I don't get spammed and he kind of sort of knows what I'm talking about. I forgot to copy the link. I paste the link. I hit send. I close the tab, and that's 10 steps. That's 10 steps in probably about 30 seconds of my life to simply get Jason to this page, and he still has no idea what paragraph I wanted him to read. Well, ouch. There's a huge frictional barrier that exists when I want to share privately, a social interaction that's been completely overlooked by current social media. So now, let me show you the technology that we've built that's helping our users share more than they ever did before. So, here I am browsing along in a Groupnotes world. This time, when I want to share with Jason, or even my whole team, I simply select the content that I want to share, pick who I want to share it with. I can add a message if I want to, and I'm done. And this works on top of any web page on the entire internet. The next time Jason's in his browser, it could be right now, he gets a notification, not on our web page, but built directly into the browser itself, telling him I left him a note. When he clicks that note, he's taken directly to the content that I've shared with him. When he gets there, Groupnotes tells me he's seen it, we can reply back and forth, and we'll never lose track of another discussion ever again. Now, this technology is truly unique. We're actually working with our lawyers at Gowlings right now to explore patents in this field. We're not just applying standard web templates to build another app or website, we're actually pushing the boundaries of what you can do with web code, making this work all over the internet. So, right now we're casting the net wide with Groupnotes, providing this very simple value proposition of being the best and fastest way to share web content with your friends. What this is doing is putting feelers out into a huge variety of verticals to identify our low-hanging fruit and the first vertical we're going to hone in on and scale within. The key to our monetization is intent-driven data. So everyone from our advisors to top VCs have told us not to worry too much about this right now and focus on building the best product possible. We do maintain close contact with our advisors at Google and within the ad buying space to make sure our data is legal, desirable, and valuable. In short, it's better than current social platforms because of the added context as well as the added sentiment behind the data, which leads more directly to user intent on the internet. Lastly, who's the team that's pulling us all off? Well, here we are in our Groupnotes orange pants. Together, we've designed your BlackBerry Z10, we've done chip design for your MacBook, and we've created some of your favorite websites. We gave that all up to work together full-time on Groupnotes. We actually came together in a series of competitions, eventually becoming the first Canadian team to win the world's largest startup competition, beating out over 10,000 other global entrepreneurs. Luckily, we're not without help. As you can see, we put together a world-class advisory team of innovators and entrepreneurs and stay plugged into the Hyperdrive Mentorship Network, the accelerator we just graduated from. We're Groupnotes. We're giving people the tool that they've been wanting to share more of the web with the people who really matter to them. We're not building a lifestyle business here. We're trying to build a company that's going to employ hundreds of highly technical employees right here in Ontario, but we need your help. We're looking for funding to pursue IP as well as make our first couple of hires while leveraging other government programs. The funding will actually have a huge impact on our team of young entrepreneurs. So we thank you for the opportunity to present today, as well as all the support the ELP has already given us. Thank you.
So thank you, Matthew. You have 44 seconds left, so you can bring your band out for a quick present.
They're manning our booth, sadly.
So I'll turn it over to the judges for questions. Oh, actually, before
do you wanna get in closer?
I better, Hattie, I'll introduce you after this session, and I won't forget. So, questions? Do you want to start, Hattie?
How big the website? Is there a limit to the size of the document that you want to share?
Oh, the size of the groups?
Yeah.
So right now, through our like research, analytics, customer interviews, we found that for social sharing, the ideal size of a group is 8. So we're testing out a hard limit of 8 because we find that the highest density of notes happen when you're in a small group of your closest friends. So once you have more than 8 people, it's not as much private, and the share density goes from like 40 notes a day per person down to way lower numbers. So we're testing our hard cap of 8, but there's no technological limitations to the size of the group.
I quite like the product. It's very cool.
Thank you.
I just wonder, is this a standalone business, or will this be something that will be incorporated into the Googles and everybody else as a feature set?
Do you want to do this one? You want me to do this one? Okay. So we actually we already fended off like a $2 million buy offer a few months ago, but basically right now we're carrying on this standalone business. We're not looking to get bought out super early or anything like that. And the way we're seeing our users use it, it's very different from anything that exists. I have no doubt that other companies will be wanting to buy us, but as of right now, we're continuing on with the 5 of us and working and seeing if we can grow our team up in Ontario.
In terms of competitors or potential competitors, do you, does somebody like Evernote or any of these guys have any kind of sharing capabilities, or like, do you hear about this coming down the pipe?
Yeah, I mean, I can speak specifically to Evernote. I'm probably one of their biggest users of the platform. And I mean, all of these platforms, they still have the same frictional barriers to sharing online that email does. Like, personally, Evernote's actually worse than email for me. So even though they do functionally do sharing, it's not in the same easy and contextual way that we do it, kind of thing.
Yeah. Basically, all of them take the same model, which is make sort of like the Pinterest-style big one social media. We call it a social media repository. You go to this site, you consume a bunch of content that people have been sharing, but we've turned that model on its head basically and said, why do you ever have to leave the website you're on to share and talk about anything? Shouldn't my discussion just be centered around that content? And right now, no one else is pursuing that path with that low friction.
Just one more question. How far along are you, and when will you be releasing this product to the general population?
You can sign up. Come by our booth and we'll put you on the platform. We actually have like more features than were in the video because we cut it two weeks ago. We have like 4 people coding 16 hours a day, so things change really, really quick.
Just jump in on that. What about Microsoft OneNote? Because I gather that's probably the thing that's being used mostly by, say, university groups and stuff.
Do you want me to do it, or you? Or?
Yeah, you can.
I mean, so in terms of like, we are university students, we're on like the scholarships to the XDEI, and we looked for tools like this a ton. No one's on the Microsoft products in terms of our experience and in terms of our research. We've never talked to, we only do 2 things in our lives. We are either coding or talking to customers and looking at analytics, and no one's ever actually, we asked people, like, do you use OneNote, do you use some of these other annotation tools, and no one's actually ever said yes to any of those questions so far in terms of the students. Enterprise, very different.
Yeah, like for my experience, OneNote works incredibly well when you want to put high overhead into doing a project or as part of a course. But when you just want that one-off, quick kind of sharing, all that kind of stuff, that's where our platform really excels over all those other guys.
So my question is regards to monetization again. So at what point do you think you're going to reach critical mass in terms of users to have the kind of data that you need to monetize your product?
Yeah, so looking at intent-driven data, I mean, this space is still fairly early on, and the main acquisition tool for this data is companies like us. The companies like Yahoo, Google, they're all looking at either purchasing the startups themselves or buying the data directly from us. So the vote's still out on exactly when that switch kicks in. But if you look at past markets and that kind of stuff, you're looking at around, north of 5 million kind of thing users is when you can really turn on the switches hardcore and turn it into a real moneymaker.
Yep. On the way, though, if it's a slower grind, there's other options. There's competitors out there they don't do what we do, but they have the same type of data. The best they do is actually track copy and paste on a website, and you pay them to provide hotspots of what people are copying and pasting. So on the way, if we need to make some money, what we can do is do hotspotting on websites, but we can give them more data than just what's copied and pasted. Because one of the biggest problems is if I go to a website and make fun of it with Groupnotes, I start getting ads all across the internet for that product that I was making fun of. But we capture the sentiment and the context behind that conversation, and we can tell that either advertise to those 4 people talking or not. So there's little bits on the way that we could monetize if needed if we don't grow rapidly this year or something like that.
Yeah, essentially it's, reaching out to website owners saying, hey, I have 50 notes that users have posted on your website. You want to look at what the sentiment behind them was, kind of thing.
Right, I'll be by your booth.
Excellent, thank you.
Any other questions? No. Very good presentation.
Great.
And your time is up.
Okay. Thank you very much.
So Mauricio, will you come up and just bear with us as we finish scoring here? Maybe while they're doing that, I could just briefly introduce Hattie. So if you would just bear with me. Hattie's joined the panel. Hattie Mahabadi, who's the president and CEO of Canwin Consulting. Dr. Mahabadi is a recipient of the Office of the Order of Canada for his contributions to advancement of science and innovation in Canada. You're lucky to have him here today. He's an innovation leader with over 30 years of hands-on experience in innovation and the successful commercialization of novel technologies, including 7 years as vice president of Xerox Innovation Group. By the way, it said VP, so that was another acronym, and director of Xerox Research Center of Canada. And so thanks for joining us today, Hattie. We really appreciate the time you're bringing to this. Has everybody scored the last one? Okay. So Mauricio Meza is from Komoda. Komodo, is that the way you pronounce it? Komodo?
Open Lab.
Open Lab, Inc., and he's from the Digital Media Zone at Ryerson University. Over to you, and please introduce your team.
Hi, so my team is actually coding, so they are not here today, so that's a good thing. So I'm going to start by telling you what do we do. Is this the green button? Sorry. Oh, so where is the... Oh. So this is Chris. So Chris is a 16-year-old with cerebral palsy. And that doesn't prevent him from using the computer at all. He actually does video editing. He does a lot of stuff in his computer. The problem he has is that due to his physical disability, he's not able to take advantage of smartphones and tablets. So all the information we have in the palms of our hands, for him, it was impossible to use until we start working with him. So now you can see a tweet that Chris' mom sent a few months ago. So now Chris is able to use a smartphone with very, very simple interfaces. So the way we do it is with Tekla. Tekla is our product line, and what we have is a set of hardware and software tools that allow people with very limited mobility to control their smartphone or tablet with very simple interfaces. So the hardware is this device I have here. It's called the Tekla Shield. So this is a Bluetooth interface, connects wirelessly to my iPhone, iPad, or Android device, and it connects to standard assistive devices. That could be something as simple as a big button that Chris could control with his head, or other types of switches like a blinking switch or a blowing switch. It can also integrate into wheelchairs. So in the same way that someone may be driving their wheelchair using a joystick, head controls, they can use their smartphone or tablet. So what's our business model? So we actually sell the hardware. We have online store. We reach a lot of our users that way. We have a network of resellers. We have resellers in North America, Europe, Australia, and Japan. And we also have partnership with wheelchair manufacturers and other hardware manufacturers to incorporate our technology into their products. We also have software. So the software we follow is a freemium model. So the app that provides basic access to the device to use your Facebook, your Twitter, it's free. Switch optimized apps for our users, those are for sale. And those we distribute through app stores, iTunes Store, the Google Play Store, and we're also working with wireless carriers to add them to their proprietary stores. So there are 12 million people in North America and Europe that right now are unable to use these devices. The way we reach our customers, we have two models. So we work with rehab centers, clinicians to let them know about our technology. To give you an example, this device is now approved in Ontario to receive government funding for those users that require it for communication. But where we see the biggest opportunity for us is to work with wireless carriers and handset manufacturers, because there's aggressive accessibility legislation coming into place into Canada, the US, and Europe that is telling wireless carriers that they have to have accessible handsets. We already have a partnership with a Canadian carrier that they're going to start subsidizing this hardware for their users with mobility impairments. In the US, in the fall of this year, the 21st Century Accessibility Act is coming into place, what basically says that all devices that connect to the internet need to be accessible. So now we're working with all these companies telling them that we already have a solution for what's coming to them in a few months. So what have we done in the 2 years we've been in business? So this is the first version of the hardware. We shipped this since February last year. We shipped 500 units to 18 countries. Last year we were invited by Google to present at the Google Developers Conference. So they provide us a booth and they allow us to talk to developers about accessibility and why it's important for developers to create apps that are accessible for everyone. We visit Apple headquarters in the fall, and after that we became a licensee for their Made for iPhone program. So we're already working on the third version of the hardware that's going to be made for iPhone. And this is the upcoming version of our hardware. We're going to start shipping in about a month. This is what I have here. This is the first time I actually show it in public. So this is almost ready to launch. So what are we planning to do if we win this competition? Is, as I mentioned, we're already working on the third version of the hardware. That's going to be an Apple compatible device. It's designed for volume manufacturing. We'll be using the funds for injection molding, certification. We already have a full-time developer working on it. And I'm just going to finish by leaving you with some quotes from our users. So we have, as I mentioned, about 500 users around the world, and this is what we are allowed them to do with our technology.
Thank you, Mauricio. This is an interesting business, so who would like to start with the first question? Patty?
You mentioned you are following two different approach in
Yes.
creating business. Which one is the focus? And for the hardware, you mentioned this is the first time you are showing it here. Do you have intellectual property for it?
Sorry?
Do you have IP for the hardware or not?
Actually, what we use open source as our development tool because we're in a very niche market. We found that open source is a better protection for us. When company sees that there's something already available, they come to us and said, can we take what you have and modify it? So that's what have helped us gain support from wheelchair manufacturers that they see that we can customize for them. That also has allowed us to gain attention. And just to give you an example, Google has paid some of our development because they are interested in developing open source technologies.
Mauricio, I like the fact that you've got the Ministry of Ontario now backing it, also an insurance company and pursuing the carrier strategy. My question is there additional approvals you need? And of the 500 units that have been shipped so far, was that at a revenue component for yourself, or was that more of a beta test?
So that all those 500 units were sales. We did beta testing prior to that, where we give the units away to users to gather feedback. But those 500 units were sales. And your question before, sorry, what was about the insurance?
Yeah, whether you needed any other approvals to sell more widely.
So the device has to be certified for FCC and ECE marking to exporting. The first unit was certified. We're right in the process of certifying this unit for sale, for safety, FCC testing, all that.
So you mentioned you've got 500 units out there in the marketplace already.
Sorry?
You mentioned there you've got 500 units out in the marketplace already. So what kind of traction do you have in the marketplace? Is there pent-up demand for your product? Are you getting orders that you can't fulfill right now? I mean, what's happening in the
so right now we actually we're in a stealth. We discontinued the previous model last month. So since January we have signed new resellers. So we have two of the biggest online resellers of assistive devices in the US are now our distributors. We have signed an agreement with, it's a subsidiary of one of the biggest wheelchair manufacturers in the world, that they are gonna be selling these devices in the US too.
Can I ask a quick question?
Well, there's just something that's not, it just hasn't really, wasn't covered a lot in the materials, and I wonder if you could just speak to the economic impact in Ontario of what you're doing and perhaps related to the production of the devices.
So in terms of, we have right now a number of employees in the company. We have created 5 full-time jobs. Also, one of the big deals about what we're doing is that we're allowing people with disabilities to be out in the community. And just to give you an example, one of our developers, he's also a user. But now he feels confident being outside, coming to the office, because now he's independent. If something happens, he's able to call for help. If he's able to book his Wheel-Trans to go and pick him up. So just in general, the impact of these devices in the lives of people is tremendous.
No, that's huge and really exciting. And are the devices actually manufactured in Ontario?
Yes, so the device is manufactured in Ontario. This version right now it's manufactured in the US, some parts, but the production of the previous unit was fully here in Ontario.
Thank you. My question was asked.
Okay. Just a quick one. How much, you seem to have come a long way in 2 years. How much money has been invested in the business, and what's your sort of monthly revenue right now?
So in general, most of the funding that we have received is through government grants. We receive support from OCE, FedDev Ontario, and also IRAP is supporting some of our development.
Yeah.
I think until now we have received about $200,000 in grants. And I think in 1 year that we start shipping the first unit with limited distribution, last year I think we made $100,000 in revenue. I think this year in the first 3 months we had about $100,000 in the first 3 months.
So that device, what are you selling it for?
This device goes for $350.
$350, and you see that coming down over time, I assume, the price?
The idea is that wireless carriers are going to subsidize it.
Yeah.
So for the end user, it's going to be a cheaper cost. As I mentioned, in Ontario, users can get up to 75% covered by the Ministry of Health.
I've got to cut myself off, so so we'll let the judges do their scoring, and thank you, Mauricio, and we'll invite Scott up to the stage.
Thank you.
Well done. You can see I go into the money. Show me the money. Yeah. Just as they're judging, you can see that some of you have seen the Dragon's Den, and O'Leary talks about show me the money. So, yeah. Has everybody done their recap?
Yeah.
Okay. So I'll introduce Scott McCallie from Lunanos. And he's sponsored by the Institute for Optical Sciences at the University of Toronto. So welcome, Scott. It's over to you.
Great, thank you very much. As I was introduced, my name is Scott McCauley. My partner, Leo Mui, is in the audience, and we're from Lunanos. And I'd like to start today by describing how some very, very small organisms cause a significant problem around our world. So specifically, let's talk about the bacteria that are on this wheelchair. Now, in a hospital where you have patients that have compromised immune systems and a high proportion of pathogenic and even antibiotic-resistant bacteria, this wheelchair can make people sick. And infection control specialists have told us that tracking the cleaning of each and every wheelchair and the up to 10,000 other pieces of mobile equipment that gets moved from one end of a hospital to another is a significant problem. So how big of an impact do these tiny bacteria have? Well, 1 in 10 patients who are admitted into a Canadian hospital will pick up an infection during their treatment. This leads to 8,000 deaths every year in Canada, can increase the treatment costs by up to $45,000 per patient, and increase the in-hospital treatment time by as much as 2 weeks. And this problem isn't isolated only to Canada. It's estimated that within the developed world on the whole, hospital-acquired infections are the 4th leading cause of death. And although there aren't any reliable statistics, it's likely that the problem is even more significant within the developing world. So the opportunity for Lunanos is that approximately half of all these infections are preventable through improved infection control practices. And our solution is called IndiClean, a cleaning indicator sticker that you can apply to our wheelchair or any other piece of mobile equipment that's in a hospital. So when you apply a disinfectant to this piece of equipment and the sticker, the proprietary coating changes color, indicating to staff that the piece of equipment has recently been cleaned. Over a set period of time, the color then changes back, indicating to staff that the piece of equipment should be cleaned again. Now, why do we think this will be effective in improving cleaning practices and reducing hospital-acquired infections? Well, first, it's incredibly simple, and so it can be easily applied within hospitals without significantly changing their current practices. Also, it's multi-use. It doesn't require expensive detection equipment or consumables, which helps keeps the cost low. And finally, there are no medical regulatory requirements around a product of this kind. So the idea for IndiClean came directly from conversations that we've had with infection control specialists and the feedback that we've received from within Ontario, for example, from Mount Sinai Hospital, from across Canada through infection control industry groups, and even internationally through discussions with doctors at the Fortis chain of hospitals, has been very positive. And currently, we've developed a proof of concept prototype and are looking to develop a version that can be tested in the field. So currently, there are no products quite like IndiClean on the market. And the closest alternatives are either costly, complex, or both. And so although they're useful for periodic auditing of cleaning practices, it's unlikely that they'll significantly impact everyday experience. And the overall market size for infection control and prevention devices and products was $19 billion in 2011. But down on a micro level, through discussions with hospital staff and available statistics, we've been able to estimate that there are approximately 28 million pieces of these mobile equipment within Canadian and American facilities. So any funds from OCE would go towards assisting our commercialization plan. Specifically, we're looking to develop an in-house scale-up facility that would allow us to manufacture our testable prototype. We would also like to continue to develop the relationships that we've established with hospitals and doctors so that once we're ready to begin testing, we can do so quickly, and also to gain more market insight in terms of potential pricing strategies and other protocols. Finally, we'd like to begin discussions with potential distributors who would like to carry the final product. So the goal of Lunanos is to improve cleaning practices within high-risk facilities and reduce the rates of these unnecessary and costly infections. We believe that IndiClean can provide a simple, effective, and low-cost solution to help hospitals track the cleaning of their thousands of mobile equipment within their facilities. Thank you very much.
Thank you, Scott. Shall we start with Janet, or Julia, excuse me?
Thank you very much. I think we're all quivering knowing what the need is, but in terms of developing your prototype, obviously you may end up with something that is more expensive than you envisage. So when you say your competitive advantage is low cost, how certain are you about that, and given what you know about your product so far?
Currently, it's essentially just a film, and so again, right now the prototype that we have is quite low cost. There are still development that we need to do. In terms of the cost in total for the facilities, all the other alternatives require, or can only be applied once, whereas we expect this to be able to last for months at a time before needing to be replaced. And so even if potentially our manufacturing costs go up slightly with different materials that we may need to use, the overall cost compared to any other competitor would still be significantly lower than what's currently out there.
Thank you.
So from what I read and from what you were speaking about, your trigger seems to be time in terms of the change of color to indicate it needs to be cleaned again. Time is not normally the trigger in a hospital for the need to clean something. it's often the fact that there has been some kind of a biologic incident that now makes this an unclean piece of equipment. A patient has been wheeled down for a test, and now that wheelchair is potentially contaminated because there's been at least 2 people touching that wheelchair. So I'm a little concerned that your trigger might not be quite the right trigger.
So from our understanding and conversations with the environmental cleaning staff in hospitals, the trigger for cleaning varies depending on where you are in the hospital. So if you're in an inpatient center where a patient is there for a number of days, cleaning doesn't actually happen until the patient has been discharged from the room. In an outpatient setting, it is timed. So they have policies that say, every 24 hours, this space must be cleaned. But again, that's for everything that's tied down. They have policies for each equipment should be cleaned every day for specifically these mobile equipment. But right now they have no way to know that. If there is an outbreak situation, then yes, they will initiate those separate protocols to clean everything. But those are very costly. They do not happen every day. Hospitals want to avoid doing that at all costs. And so for these mobile equipment, they should be cleaned approximately every day. And it depends on the facility. But from our discussions with the environmental services staff, that is the trigger that they use.
So I have one other question. Am I allowed?
Be quick.
Okay. So I wondered why, in terms of your monetization, I wondered if you'd thought about a licensing play.
It's definitely possible. It would depend. In terms of our IP strategy, because this is a coding, there are a number of, within the coding industry itself, there's a lot of players that do not patent their codings. It's very difficult to reverse engineer, et cetera, et cetera. And so we're working with our lawyers to determine that proper balance between trade secrets and patents. If we do end up with something that can be patented and protected very strongly, licensing may become a more significant option. But at the moment, we're currently proceeding with the idea that we'll go with a balance of the two. And so we may need to keep at least part of, for say, the manufacturing or something in-house so that we can protect those trade secrets.
Okay. Just a quick question about, you mentioned in your business plan that you're also going to try to produce a disinfectant as well.
Yes.
Aren't you kind of concerned about the focus? Again, if you're focusing on the sticker and the coating, and then you're also going to go after the disinfectant market at the same time, right? And is that something that you really want to do, given that you're probably going to have to sell it, it's going to be a low price point kind of?
So I didn't really mention the disinfectant product in this presentation because it's not the focus of our plan for the money that would come from this competition or this project. That product is being developed in partnership with an existing disinfectant manufacturer and producer. And so our component of that project is only the formulation. Once that is complete, we will work with them to help them validate and scale up the manufacturing, but they will be responsible for obtaining the drug identification number required for a disinfectant within Canada, the manufacturing and the distribution, and we would be obtaining a royalty off of those sales in exchange for the formulation. And ideally, in the future, we see that this cleaning indicator sticker can be applied, if we also have a disinfectant product that is partially ours, we can work together with, those two products can work together, and we can provide kind of a complete package.
Thank you, Scott. We'll have to close off now, and Janet owes a couple of questions down to the right-hand side of the panel. So please do your recap. And we have to, we're running out of time. Yeah,
Good?
that's it.
Excellent.
Yeah.
Thank you very much.
Thank you. And so if Josh would come up and get organized.
I'm in fact not Josh. My name is Jesse. I'm here in his place.
So you're Jesse Guild, I take it.
Yeah, co-founder of Marmot Labs.
Okay. So Jesse's with a company called Marmot Labs, Inc. No, it's Jesse Guild from Marmot Labs, Inc. And he has been working with Velocity at the University of Waterloo.
Yes. Okay, thank you.
And could we reset the clock? Could somebody reset the... Thank you. Please start, Jesse.
Okay. I'm Jesse Guild. I'm a co-founder at Marmot Labs, and our product is Decision.io. And what it is, it's a collaborative platform for decision makers, and it helps teams manage online submissions. So I'm just going to play you a video, and it'll explain a little bit more.
Welcome to Decision.io.
If you can hear it.
At Decision.io, we help you collect, review, and evaluate online submissions. Whether you're a foundation overseeing grant applications, a school awarding scholarships, or a business collecting ideas or resumes, we help you improve your submission process so that you and your team can make more effective decisions with less effort. With Decision.io, you can create simple workflows that allow you to intelligently funnel your submissions, collaborate in real time, integrate with other familiar tools, and send feedback reports to your stakeholders. Not only will you save time and energy, you'll also make better decisions. Sign up today to get an invite to our beta program. Decision.io, the best way to manage online submissions.
So that's a little bit about our product, and we developed it because a few of us work at organizations like Communitech and the Accelerator Center, and we ran into the problem of getting a lot of applications for funding. So we built a solution for that. And we figured that a lot of other organizations have this same problem. We put the size of the market to be around $1.7 billion, and the number of organizations at around 1.4 million. But our immediately addressable market, we believe, is around $200 million because we're targeting ecosystem-enabling organizations like OCE, institutions like the University of Waterloo, and granting foundations like Social Venture Partners. So it's a fairly new space, but there are some competitors like WiseHive, Submittable, but we believe there is room to compete, and we compete on the basis of our really simple user experience, the simplicity in integrating with other tools, and the ability to give really rich feedback to stakeholders. So we're a software as a service company. Our delivery model is through the web, so you can use it on any web-enabled device. Our subscription model is yearly or monthly subscriptions. And our pricing is based on the number of users, submissions, and data storage. And we use pretty simple plans to get people going. So we're currently in a closed beta of the product, and we started working with customers very early on. Our metrics are actually a little bit better than this now. We're at about $25,000 in annual recurring revenue from about 10 customers. We've managed over 500 submissions. We've had about 150 users on the platform, and so far everybody's opted to use it again. And just for a little vanity metric for you, we've done over $1 million of funding decisions through the platform. So organizations such as OCE have used it and delivered over $1 million worth of funding. So here are a few of our customers, our friendly first customers. However, we now have customers in Boston, Halifax, BC, and Arkansas. And we're a Waterloo-born team. We operate out of the Velocity Garage, and a few of us graduated from the Masters of Business Entrepreneurship and Technology program at the University of Waterloo. So we're here to ask you for $25,000 to help us accelerate our product to market. We currently are in the closed beta phase, but we would like to launch publicly soon. We have 2 full-time employees, and we would like to add a 3rd to the team as well, and this funding would really, really help us do that. So we are Marmot Labs, our product Decision.io, and we're here to help teams like you make decisions and manage online submissions.
Great. So we'll start with the questions, and Hattie, I know you're itching to ask a question last time. Well, why don't you lead on this one?
A great presentation. Could you tell me what is your revenue growth figure for next 3-5 years?
We have a forecast, but I mean, it's hard to really tell at the moment, being as we're in closed beta. Given our competitors, though, they have done pretty well. Our closest competitor did about 2.5 million in their first year. So we believe that we could be equally competitive with that and hopefully reach $1 million in revenue within our first year and a half.
Jesse, how defensible do you think your IP is? I see the space is very crowded, lots of folks nipping at different pieces of what you're doing, and just wondering how you rise above the rest.
I think ours is more of an execution play rather than defensible IP. We really do believe that our interface sets us apart because it is so easy to use and people are able to really intuitively pick it up and understand it. We go a little bit of a different route than some of our competitors who have built out their own custom form building tools. Instead of doing that, we've opted to integrate with other form builders like Wufoo and SurveyMonkey and Google Forms. So we really are going with the ease of use and hoping that'll be our main competitive driver.
You didn't spend a lot of time on how you differentiate from your competitors, and I guess we kind of have to assume that the user interface is better. But when I looked at all the competitors, I thought surely that's something that they could improve as well and maybe knock you out. So what's your response to that?
Our kind of long-term goal is to sort of move more into the decision management space and try and enable better decision making in larger enterprises. We're now working with one of our first larger enterprise use cases right now. So we'd really be building out features around enabling the collaboration a lot more.
Any others? No? Well, thank you very much, Jesse.
Thank you.
Is this Nora? Nora? If I pronounced your name right, is it Nora?
It's Nora.
Nora.
Yeah.
Okay.
Let me see if this.
Okay, so Nora's from Missouri, is
Missouri,
it?
correct.
Missouri, and she's working at the Digital Media Zone at Ryerson University. So over to Nora, and please introduce your team.
Hi everyone, my name is Noura Sakija, and Majid Masad is there in the crowd, and the rest of the team are actually working. We have some projects coming up. So my family has been working in the fine jewelry industry since 1953. And with time, I've noticed that the industry has seen very little innovation, especially when you compare it with costume jewelry. Because customers are always looking for unique designs, even though there are so many talented designers out there. But these designers have no means to take their products to market. When we were thinking of solving this problem, we came across a very successful crowdsourcing platform called threadless.com. And we thought that crowdsourcing is actually the best method to bridge the gap between the customers and the designers, while using our core competencies in the manufacturing as well as the industry knowledge very effectively. So we came up with the solution, which is Missouri. Missouri is a web-based technology company with manufacturing capabilities. Our process is very simple. Designers from all over the world submit their designs for free on Missouri. People then comment and vote on the designs. Based on that, we select the winning designs, manufacture them, and sell them. We own the rights to the designs, and we compensate the designers with royalties and marketing. With that, we gain the customer's feedback before we invest time and money in manufacturing products that the customers do not want. We have been using the lean startup methodology, so we've been implementing in phases, and the first phase was at the end of September 2012. And since then, we gained traction from over 400 designers in over 30 countries across the world. We currently have 17 products in our shop, and we're constantly adding winning designs. And we established sales with minimal marketing. From a manufacturing perspective, we're able to produce simple and complex designs. We have a very strong network of manufacturers in Jordan as well as in Toronto. And this strong network of manufacturers enable us to use a just-in-time inventory model, which has been absolutely crucial for us to bootstrap to this point. So what is the impact of Missouri on Ontario? One of the most obvious impacts is the job creation in the technology, manufacturing, business, and business support fields. And as I mentioned, we've been dealing with Canadian suppliers, so we buy our diamonds from Canada to ensure that they are conflict-free. We also have been using Canadian manufacturers, for example, Massa Jewelry on Dundas Street and Mearson on Queen Street recently, to produce our products. And we are looking to become a global company with a focus on the North American market. So once we establish that, Canada or Toronto will be the hub of the production for the North American market. One of the interesting things we're working on with Ontario universities, including George Brown University and Ryerson University, is deploying a better design program for their students. So we will be launching design competitions for them in September and allow their students to get customers' feedback before graduating. From a marketing perspective, we've only been using social media so far. We started crowdsourcing the sales by giving the designers a higher percentage if the sales happens through their unique URL. We're going to be moving to paid marketing and affiliate marketing when we carry a larger slew of products. From a revenue stream perspective, we're currently an online retailer, but as a natural evolution of our model, we're going to be selling our products through large retailers to achieve economies of scale. We also have had some interesting requests to use our platform as software as a service to launch competitions for other companies, jewelers, big jewelers in Canada, as well as fashion companies. So we are looking at a licensing model to use our software as a service. And the software as a service, as well as Missouri as a wholesaler, are what I call our growth accelerators. Therefore, we're going to be using the OCE funding in the growth accelerators mostly for the development, the technical development of the licensing model, and the rest of the proceeds will be used in part of the legal fees as well as the business development such as marketing. So why invest in us? We are a very strong team with a unique idea. We're the first to market to crowdsource fine jewelry. We've gained traction from customers and designers across the world. Minimum cash burn due to our just-in-time inventory model, and most importantly, we have multiple revenue streams. Our team consists of members who have experience in various areas and very complementary skills, from finance to operations to technology to raising capital, and most importantly, fine jewelry industry. Thank you.
Well done. Who would like to go first? Hattie?
This was great presentation and great area. I have two questions. One related to the scale of manufacturing with this.
Yep.
What do you see the scale is going to be, and as a result, the cost of producing the jewelry? And second question is related to your revenue source. This idea can be used for many, many different things. Are you planning to list those and do something with it? And
yes.
Yeah.
So in terms of the scalability and the production, so we need about 2 to 3 products to break even on each design, whether produced in Canada or in Jordan. We use 3D printing functionality, so once we produce the first mold and perfect it, we can produce off of it really quickly. We have access to several, we've been forming a lot of relationships. We've access to several workshops, and therefore we can scale up once we get the demand. And in terms of using our platform for other industries, we actually will be working with a fashion company that sells dresses to crowdsource a competition for them, because the customers see a huge value in getting the customers' feedback before they invest time and money in producing something. So jewelry is only the beginning. We own the end-to-end process for jewelry, and we can introduce it for different brands in the market. But the platform itself can be used for many other industries, especially because we have designers, fashion designers and jewelry designers on board.
Thank you.
Just curious about fine jewelry. I think a lot of folks buy it because of the brand, and it's a recognizable brand.
Yep.
In this case, because you're doing individual designers that are less well known, you're probably coming down in the dollar value. but I'm wondering, does that allow you to not go the Etsy route where they're doing costume jewelry, but to actually go to highly customized jewelry, maybe making something individual specific, initials or whatever, and making a very long tail out of your business plan?
That's a very good question. So in terms of the Etsy model and the costume jewelry, we produce jewelry, diamonds and gold, but we also produce silver. So we have very varying price points. And we actually have found out that customers really like the connection with the designers. It doesn't necessarily dilute our brand. And the difference between Etsy and us is we take care of the manufacturing to ensure a consistent quality of the product. And that is what's going to help us with the brand. And sorry, what was the second part of the question?
Just wondering if you could highly customize it and make it an extra long tail.
That's so we are actually looking to introduce engagement rings and introduce something similar to the 99 design model, which is someone would put a call to say I want an engagement ring to be produced only for me, and the designers would respond to that. So we're definitely looking at the customization in the higher end item that have a lot of diamonds.
Thank you. You mentioned that you're partnering with colleges and schools. Does your product also have a design engine as well? Is it, like what I saw was people uploading pictures of custom jewelry, but do you have a design engine as well to help people do 3D imaging and stuff? Is that what you're talking about? Or?
So we have design submissions. We do not have the engine in place, potentially in the future, but different designers use different engines, and I would be cautious of putting something specific to our website because people are using different engines to design. We also accept designers to have detailed sketches because we're able to produce anything basically, and this is one of the things that the designers like. They don't have to put the technicality down. We take care of that.
Thank you.
I have some jewelry. If you guys would like to see, our booth is over there. Would love to show you the quality of manufacturing and the designs.
I just had one little question.
Yeah.
Fine jewelry. What is the definition of fine jewelry? And where is that line?
Yeah, it varies. Sometimes fine jewelry, people define it as gold, diamonds, and the higher end items, but also silver, sterling silver goes into that category. So that's why we're including silver as well in the fine jewelry brand. We're always looking to introduce additional materials as well. We just recently learned about Canadian designers who use wood with fine jewelry, so we might be looking at that too.
Okay, so it's partly the materials and partly the design.
The design, yeah.
Yeah, thank you.
You're welcome.
I'll just quickly ask you a question. I may have missed this, but where are you in the revenue curve?
So we started sales. We haven't implemented any marketing. We started sales. We started sales in December. We have less than 10,000 currently, but we're actually looking to start the marketing. As I mentioned, we only have 17 products in our shop. So we started generating revenue.
Okay, good. Thank you. Well, thank you, Nora.
Thank you.
Well done. And I guess Dan's on deck. It's an interesting platform, technology.
So I'm already at 30 seconds.
No, don't worry about that.
Okay.
Can you reset the clock,
perfect.
please?
I'm sorry?
Okay, so this is Dan Hosen-Zadeh. Is that close?
Very good.
From Pathcore, Inc., and working with the Institute for Optical Sciences at the University of Toronto. Over to you, Dan, and please introduce your team.
Thank you. So I'm Dan, as already has been introduced. So I'm from Pathcore, a co-founder of Pathcore, and my co-founder, Dr. Ann Martel, is in the audience today, so for support. So I want to talk to you a little about pathology and what we do. We essentially develop pathology software that manages the workflow in pathology centers, and on top of that, we add analysis tools for advanced analytics. To give you some background, about 80% of all medical treatment decisions today depend on pathology. So your doctor will use the pathology report to come up with a treatment plan to make you better. So in effect, pathologists are really the eyes and ears of modern medicine. I think despite this importance, the important role that they play, there's been a lot of diagnostic errors in Canada and around the world that have led to mistreatments or in some cases deaths. So several provinces here in Canada have filed public inquiries looking into the practice of pathology in the past several years. The results can be summarized in part that pathologists are not keeping pace with changes in technology. There's a shortage of pathologists due to the mounting number and complexity of tests. And lastly, there's a lack of investment in professional development and training. So we think we can help a little with this area in the form of automated image analysis. So that's what Pathcore specializes in. And so our platform, so analysis basically adds some objectivity to a field that's extremely subjective. It makes things consistent and reliable, and it also can make you more efficient. For example, we can have computer-aided diagnosis algorithms that can detect and flag suspicious lesions in an image, helping to make sure that more people get diagnosed accurately. Likewise, we can have grading algorithms that can measure and quantify the extent of disease and also the severity of disease, so helping your doctor be able to make better decisions when it comes down to your treatment. And lastly, there's a host of algorithms we can use to provide diagnostic reference tools, such as content-based image retrieval, that help the pathologist become more confident when they're making a decision. So we've done a bottom-up analysis and looked at what the size of this market could be if we were to sell our platform. And in the US alone, there are about 250,000 pathology labs, and if we had 100% adoption over the lifetime of our product, we'd be looking at about an $80 billion market. Looking at the competition, although there is some competition, we find that they're very narrowly focused, and their products don't really deliver what the pathology centers want, so they're narrowly focused. Pathcore really aims to simplify the pathology workflow by looking at the process of pathology from end to end. So that is from image creation all the way down to diagnosis. And so our products, in effect, replace multiple commercial products simultaneously. So this is what pathology centers really want. They want a simplified workflow. They want to deal with fewer vendors, and they want to have less integration problems. So our expertise in this field goes to 2007, when I began, along with my co-founder, working on a pathology image processing platform at Sunnybrook under an OICR-funded cancer research project. And that team has now formed Pathcore, and along with some of our advisors, we are trying to commercialize this technology. We are actively recruiting 2 developers to help us expand and speed up that commercialization process. And our sales strategy at the moment is really looking at working with high-valued partners and pathology centers around the world to be able to bring our platform and our product up to speed and provide all the right features that pathology centers would want. So our projected revenues in the next 12 months are derived from these early adopters. Thereafter, we plan to expand into the OEM market by being able to provide value to these large OEMs who already have existing sales and distribution channels that we can leverage by being able to provide more value for their customers. So in summary, and I see I'm a little bit fast, which is good. So in summary, this ELP award will help us to support the expansion of our development team. It's going to help us to commercialize faster, and it's going to help us to come to revenue more quickly. And so while I have the time, we have a development plan established. So beginning this year and in 24 months, we want to be at the stage where we're selling directly to OEMs. So this is large multinationals we've been talking to and are eager to see our platform in full production mode. And so a little bit more statistics about pathology. This is a field that's growing very, very rapidly. The digital pathology segment is growing very rapidly. And by 2016, it's predicted that the software market alone will be $2 billion annually. Thank you very much.
Thank you. Why don't we start in the middle here someplace? So, yeah.
So, do you have testimonials in place already in terms of some? Do you have some users already currently using the technology?
Yep.
Are you starting to use some of those testimonials when you're talking to the University of Michigan and these other potential clients, just in terms of trying to get some traction in the marketplace to kind of seed demand for this beta testing almost, because it's a long sales cycle, I would imagine.
Yeah, you're talking minimum 6 months, 12 months, 18 months, yeah. So that's what we've been doing. So we're dealing with a lot of pathology centers that are active in research, and so we're getting this platform in their hands, and they're able to use it, they're able to integrate it with their existing hospital infrastructure, and really see how it functions. And that's been key to our development and sort of production cycle.
Have they put their name on, have they been willing to use their name to sell your product for you?
I can't disclose anything legally, but
okay.
Yeah. But yeah, so we do have customers, and we have been adopted already. It's just due to the terms of the agreement, we can't really use the name until.
Understood. Thank you.
No problem.
So I just had a question regarding the Sedin image viewer, and whether or not. So I'm looking at the platform, part of which is software. Is there software hardware? Is the software independent? I'm not sure how it works.
Yeah, so we're primarily a software platform. However, we deal with many hardware components within a pathology center. So we integrate with hardware components, but we don't develop any hardware ourselves. We're strictly a software platform.
Patty?
Yeah, it's a question regarding the approval and government regulation. This is health-related technology, and I guess beyond proving that it works and is better, you need to get different government in different parts of the world to approve it. As a part of your development plan, I didn't see any time frame for getting that approval, which may be a bottleneck.
Yeah, so this is partly why the OEM model is really, really helpful, because these OEM tend to develop hardware, and they don't want to invest a lot of resources in the software because it's not really what they do. And so by partnering with them, we can leverage their extensively deep pockets, because we're not ISO certified, but we have the documentation to get an ISO certification if we have to. So we're going to work with them and so really take products that are, that meet the cut and take them for FDA approval or Health Canada approval.
Follow-up question. Because of this, are you considering licensing opportunities?
Exactly. That's exactly what we're doing. Yeah.
Daryl?
Yeah. Dan, I'm just wondering about the patentable components of your software, and is that something that some large company like GE can attack? Just wondering how defensible you are.
Yeah, so GE is actually a good example. I'm glad you brought it up. So GE designs one system. That one system has to fit everybody, and in reality it doesn't. And so they target the really, really large clinical market space. So they target hospitals and multi-center institutions. So we have a bit of a different approach. We say that you can customize our platform to fit any given situation. And this is why it's really powerful in the hand of an OEM or somebody who can really integrate it with their existing platform. And so I see us approaching different customers, really. And is that clear? Yeah.
Anybody else? Julia? No, you're good?
Yep, I'm fine.
Anybody else? Well, thank you very much.
Thank you.
Well done, Dan.
Thank you.
How do you pronounce that name? Tobias? Tobias, is it? Yeah. From Reby. Come on up, and we'll just give the judges a second here to... Is everybody good? So Tobias from Reby Inc., and he's working again at the University of Waterloo with the Velocity Center, is it called, or program?
Yes.
Yeah. Please start.
All right, good morning, everyone. So my name is Tobias Dankowitz. I'm the co-founder of Reby, and today I'm here to talk to you all about flyers. So when you come home and you see your front porch littered with wet, filthy flyers, at Reby, we think we have a better solution. But first, it's important to understand why we even have flyers. Retailers design and distribute this content amongst 10 million households in Canada to gain exposure and effectively try to make more sales. Consumers browse the content to try to get the best deals while shopping. As consumers, we believe this content should be easier to access more intuitive. Today, flyers are available in 3 major ways. They're delivered door to door. However, this process is very expensive. There are no live metrics to capture who's browsed the content, what items they're interested in, and the distribution cycle suffers 2 to 3 day drop window. It makes it very difficult for retailers to plan sales. It's also very environmentally taxing if you consider the amount of paper and the distribution, the ink, and the post-processing. The same content is available on retail websites. However, as a consumer, if you want to plan your shopping, you need to visit 5, 10 different websites, enter your postal code 5, 10 different times, learn 5 to 10 different user experiences, and it makes it very tedious. If you've ever tried to do this, you might want to pull your hair out. Now, if you have a smartphone and you try to access these same websites, it's even more tedious. It's the same web service on your smartphone. And it's kind of ridiculous if you think that we have over 64% of Canadians now using smartphones, and 4 out of 5 Canadians use their smartphones while in store to compare prices. The market opportunity is incredible. We have close to 130 million people in North America, or 130 million households, receiving 10 or more flyers on a weekly basis. This is a $1.3 billion annual opportunity for the distribution alone. So we've talked to retailers and we've talked to customers and users, and we've listened. We've designed an application based on the user experience. You open up this simple, beautiful application, and you're presented with a nice newsstand-style layout. We use your location and provide you with the retail content specific to your location. And anything on the bookshelf is automatically available in store today. So we manage a time for you as well. But before we actually entered into developing the application, we sat back and we said, would anybody ever use a solution like this? So we developed a simple demo app. We went to a mall and we started talking to people. And we said, what is your idea? Have you tried digital flyers before? And the general response was negative. I've tried them, they're terrible. I don't want to use digital flyers. We then put the iPad or iPhone with the demo app in their hands, and their feedback changed drastically. They said, wow, this is really simple. I love the utility. Where can I get it? We then sat back down in the Velocity program. We launched the app in October, and we have some real-world validation right now. We have over 50,000 iOS installs. That's users using iPhone and iPad. If we look at our usage, we've distributed over 2.5 million flyer views, and we have steady week-over-week growth. But most impressively is our user retention. If you consider the amount of applications you have on your smartphone, all the apps you've ever installed, how frequently do you go back and use them? Over 50% of our entire install base checks back with us on a weekly basis, and 75% of the user base comes back at least once a month. And our user feedback on the App Store is outstanding as well. We have a 4.5-star review with people leaving comments like, I'm totally in love with this app. I've even canceled our flyer delivery. Or, better than most official store online flyers. So of course this application is free for you to download today on your iPhone, iPad. But how do we make money? The same way that retailers pay for distribution to end up on your doorstep, we charge for the distribution. There's also priority bidding. So to get higher up on the bookshelf, retailers can bid. We also have advanced metrics we can sell back to the retailers. Next, we're scaling to new platforms, providing new features. This week, on Thursday, we're launching Reby for Android, and we have over 7,500 people signed up for our launch notification. We're also trying to combat some of the issues we've faced with web development, so we're hiring on web developers. New features include flyer clippings, item-specific things such as search. So as we begin to learn how you like to shop, we'll be able to provide you with recommendations and a personalized shopping experience. The team behind Reby is composed of myself and Michael Martignac here in the audience, and we've recently hired on a Waterloo co-op student as well as a recent grad to help us develop and maintain the service. Thank you.
Well done. 5 seconds early.
Not bad.
Who would like to start with questions? Hattie?
As far as the success rate, did you compare your product with the paper's form?
The success rate compared from Reby to paper?
Yeah.
People come back to Reby on a weekly basis. I'd love to tell you the success rate of paper flyers. However, there are no metrics to gauge that. That's one of the issues we're trying to combat. I mean, there are studies that call consumers and identify, did you receive your paper? Did you read them? Yes, they have, but we'll be able to provide details of what flyer, what store, and what items did you as a consumer engage with.
Thank you.
Are you a distribution platform, or are you able to get smart with the retailers and allow them to go in and prepare their own ads for delivery through your system?
So we're a distribution platform right now. We're integrating seamlessly with their existing solution. So when they send out a package to their print and distribution channels, we get CC'd on that email. We do post-processing so that the files load on your smartphone nice and easily. And there are opportunities for us to integrate with new APIs for online checkouts and things like that in the future.
If I can ask one more question.
Yep.
Are you sending the ads, pushing them to me? Am I going to receive them whether I want them or not? Or can I just go in and search for things as I want to look for something?
So on a weekly basis, on Thursdays and Fridays, we do a push notification. If you're an existing user that has logged into the app in the past 2 weeks, we'll say your new flyers are here. What was the other? Sorry.
I'm just wondering, if I'm looking for a specific product, can I go in and ask for it and only get the flyer that I'm asking for?
Yes, so we are developing filtration systems and search features for specific products. So if you're looking for a steak, for example, you'll be able to go in and search steaks, and you'll be able to see all the competitive stores that have that product available.
What's your geographic distribution so far? Like, I mean, in terms of, like, you're talking to flyer distributors and you're talking to retailers, but you're obviously your customers are going to be Waterloo customers, but beyond Waterloo, what about?
We support distribution through coast to coast, which is part of the IP that we have. We're able to take distribution data from large national retailers and break it apart to offer, they have maybe 30 different versions of their flyer in Canada. We're able to offer targeted distribution to any sort of FSA distribution zone.
It strikes me that there are pretty low costs to enter this kind of market. What are and low barriers to entry? What are some of the tactics you're going to use to stay ahead of people who will be biting at your heels?
So there are low barriers to entry. However, the invaluable aspects are the relationships with the retailers, and we're providing them with value at an early age. We're developing those relationships, and we're providing a platform that has the highest, I guess, mobile user base right now. So if we can maintain that and stay competitive, developing new features, new functionality. For example, if you're browsing a flyer, you put an item in your shopping list, we can come back and push a reminder saying this item, you haven't purchased it. That is invaluable compared to a flyer that might lay on your front doorstep. We can provide opportunities not available in any other way.
Thank you.
So we can stay competitive with functionality.
Thank you.
And how are you differentiating yourself to flyer flow, for example, both for the purchasing client, but also for your retailer?
So again, the user base and the functionality. So we offer a lot of deeper market penetration. So we are available across Canada, which some of the competitors are not. We have more flyers available on the application, and we have higher user retention values.
Well done. I think you answered all the questions.
Thank you very much.
Thank you, Tobias. And Zing 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 is on deck.
Thank you.
You good? Everybody good? So Zing Zing, I'm not sure who your team are because it's blank, but I guess you'll let me know. You're from Sonola?
Yes.
And you're working at the Institute for Optical Sciences at the University of Toronto. So the mic is yours.
Thank you.
Yes.
So we're all familiar with the long wait times in the hospitals for medical imaging. So according to a recent survey, the wait time for brain imaging in Canada can be up to 20 weeks and cost a few $1,000s. So today I want to share with you my company Sonola and how we're going to make brain imaging easy and affordable. So standard brain imaging equipment such as MRI, CT, and PET are expensive with a large footprint. Usually they require experienced specialists to operate. And for this reason, they're often limited to large hospitals and regional diagnostic centers. And they also, the involvement of strong magnetic field or high doses of ionizing radiation also limit their uses in some patients such as infants or those with implants. So we need an inexpensive, safe, and effective way of brain imaging. Ultrasound imaging, due to its low cost and ease of use, is widely available. So Sonola is developing an add-on module that allows easy to use and affordable brain imaging with ultrasound. So why is this not done today? Because of the skull. As you can see on the left, the skull introduces strong attenuation and distortion to the ultrasound waves, making imaging impossible. Sonola's add-on module, which consists of a novel ultrasound transducer and adaptive waveform correction technology, allows you to overcome this problem. As you can see on the right, if you preform the waveform, the ultrasound wave, you can do imaging, you can do focusing and hence imaging with ultrasound. Keep in mind that the currently standard ultrasound cannot be applied to for brain imaging, but the global market for ultrasound imaging is $5 billion, with 350 million of it being the preclinical market. And our initial target market will be the research facilities and labs where the regulatory requirements are the lowest. There are more than 2,000 research ultrasound facilities in North America, which translates into immediately addressable market size of $10 million in North America and $30 million globally. Currently, we work closely with a group of researchers from Dalhousie University, and they will be our first customer.
Ladies and gentlemen, can I have your attention?
Sorry. It's okay. So next step, we will focus our market on the small clinics where they cannot afford a complex system of ultrasound, brain imaging. And they represent a market size of more than $2 billion globally. There are many multinational ultrasound manufacturers in the world now, including GE, Philips, Siemens, etc. However, they are not Sonola's direct competitor. In fact, they can be Sonola's potential co-development partner or licensees to include Sonola's module in their product. Sonola recognized this as an opportunity to engage these manufacturers to leverage their regulatory expertise and market access channels. The total amount of money we asked from OCE is $25,000 to support the development of alpha prototype and the initialized IP protection and start the strategic partnership with the manufacturers. We have secured $80,000 of funding from Ontario Brain Institute and other parties. In the next step, we'll hope to raise up to $200,000 to support the development of better prototype and further business and market strategy. So this is the people behind the Sonola. So I did my PhD in physics at the University of Toronto. In 2012, I was awarded one of 7 OBI entrepreneurs from the Ontario Brain Institute. And I have benefited greatly from their extensive network of researchers and business development. I've brought together some great advisors, for example, advisors and strategic partners, including Dr. Rob Adamson, Dr. Jeremy Brown, who are experts on ultrasound transducers and ultrasound systems. And I've also get great advices, business development advices from Professor Sindago and other staffs at the Impact Center at the University of Toronto. Thank you very much.
Thank you. Where are we going to? I think we've started this end.
Okay.
Julia?
Thank you very much. Can you talk a little bit more about your expertise and why you think you have what it takes to develop this technology?
Yeah, so I did my PhD in physics. So I'm quite familiar with the research market, essentially. So because in the process, we have to develop a lot of instrument and technology to perform an experiment. And at this time, I realized that some of the techniques I developed is very useful in, for example, ultrasound imaging. So, and also I worked closely with other researchers who's experts on ultrasound imaging, and then they think that my techniques can be applied very efficiently to the problem of ultrasound imaging.
So I take it you don't yet have a working prototype.
Yeah, no, we have where the stage of the project is early, and we have validated in terms of simulation. When we're working on a prototype, and hopefully that will be done in the next 2 months, actually. So we have all the we're working on the transducer and incorporate that into existing system now.
Have you connected with Simtech?
No.
You should.
Okay.
Talk to me after.
Okay.
Yeah.
Thank you.
In terms of your use of funds, you have labor costs in there. Is that engineering costs that or are you actually hiring somebody for Sonola to actually start the product development process?
Yeah, so this, so if I understand the question correctly, so you're asking about where the costs occur?
Well, the funding, the $25,000 in your proposal, you talk about some of it's going to be for IP protection, and some of it's going to be for hiring. I couldn't tell if it was for hiring or was it to have somebody to do some development for you. Are you planning on hiring?
Yeah, I'm
somebody?
planning on. Actually, I'm currently having 2 part-time students already working for me. And indeed, I will use part of the money to do part-time hiring.
Thank you.
Xing, I'm curious in terms of your product, in terms of resolution, size, density, if you're able to improve the ultrasound capability by eliminating the distortion, does that at the end of the day compare very favorably with what exists today in terms of CTs, other things? And or are you trying to look at unique applications for your technology as opposed to competing against those other technologies?
Thank you. So this is the slides I prepared for that question. So as you can see on the right, the ultrasound imaging, if you can do this waveform correction, it actually has almost the same performance, maybe slightly less in terms of penetration depth, but every other aspect you can get as good or very close to existing brain imaging. So in that sense, in that sense, we are not trying to replace all the other technology, but as a complementary, for example, as pre-screening or as validation of other technology as well.
I had a question which is follow-up. I just wanted to know if you have a proof of concept for your idea. Did you compare image you generated from the equipment you prepared versus MRI, for example, in different area to see if your idea works or not?
Right. Is that a question? Or?
Yeah.
So
My question is whether you have the proof of concept.
Oh yeah. So currently we don't have. We're developing the prototype. So indeed, the first step we're going to do is validate through the MRI images. So we want to generate a picture that resembles the image you can get from MRI.
So are you looking for a fund to prove the concept?
Sorry?
Are you looking for a fund to prove the concept?
Yes.
Yeah. Okay, thank you.
Any other? Again, very well done, Xing. We appreciate your presentation today.
Thank you.
And I appreciate all the presentations today. While they're completing the scoring, maybe I could just do a few final comments from my perspective. I think this format is wonderful. I think that the groups have put a lot of passion and energy into their business concepts, and And we have some true entrepreneurs of the future. So very well done. I was excited to be part of this presentation today. Thank you very much. And I could ask questions for hours at the bar. But it'll be exciting to see who the judges pick as winners to pursue their projects. So thank you very much for coming. And I don't know if it was my responsibility to actually formally thank the judges, or are you doing that? Okay, thank you, Nadia.
Hi, is the mic enabled? Great. I'd like to extend special thanks to our judges, Julia Dean, Janet Schultz, Narinder Dahal, Daryl Johnson, and Dr. Hadi Mahabdi for taking the time of your busy schedules and lend your expertise and evaluate our competition entries. I would also like to thank our moderator, Andy, kept us on our toes and for keeping us on track today. In recognition of this, I'd like to present you with a small token of appreciation. I'll just hand it out just in a second because I have a few more parting notes for you. And remember that the results of the competition will be announced at lunch, and that'll happen in Hall F just outside the doors, which you can access from the main foyer. Lunch starts at noon, so please take some now to visit the show floor, and thank you so much for participating with us today. Thank you.